All right, so today I wanted to sit down and have a brief Q&A with Dr. Julie Pyle, our new chiropractic associate. And one of the biggest reasons why I wanted to have a sit down with her is to learn more about her outside of our two truths and a lie that we've already done. But also when you hear our new chiropractic associate, you think that she graduated last month. She didn't. She actually has 10 years of experience. So tell us about your experience.
So I've been practicing over 10 years. I've practiced in a couple different states over those 10 years. So I practiced in Cleveland for most of the time. I did a couple short trips to Singapore, Virginia, and Texas, where I was a fill-in chiropractor for somebody that was on maternity leave or medical leave, just to experience different areas.
I always wish I did that. So of all the places or all the states that you've practiced, aside from your favorite being Great Lakes Health and Wellness, what would you say your favorite was? And why?
My favorite experience was Singapore, just because it's a very different culture, very different place. I was younger at the time, so I was more willing to go out there in the world and be by myself, away from family and friends. So it was a really cool experience.
Yeah, cool. So the one thing about Dr. Julie is, when we learned how to adjust in school, we learned, depending on the level of the vertebrae and the direction that we were going to adjust, we first learned how to do that seated. And then we learned how to do that similar adjustment when the person was laying on their stomach. And then we learned how to do that same adjustment with the person laying on their back. So if you notice, Dr. Julie sometimes has the seated position. So you're adjusting the same level, the same direction.
Yeah.
All it is a different positioning and a different, we call them pulls versus a push. So if you ever see that, or if you're interested in trying it, you actually get really good neck adjustments with me in the seated position. And you've seen me adjust sometimes people with that seated position. So tell us something that we don't know about you. You have a dog?
I have a dog,
Right.
a German Shepherd mix.
You live down the street from the old office.
I do.
After
I live
we
in Fairview.
moved here, yeah. What
Down the
else?
street from the old Leonard chiropractic.
Right. OG chiropractic.
I do like to run, so I am a runner.
Okay.
So
Awesome. Well, welcome.
thank
We're
you.
looking forward to having you build up between the acupuncture and chiropractic patients. So if anybody wants to try Dr. Julie's adjustments, you know that we always promote, because I myself see probably 4 different chiropractors at any time. So we highly promote that you try the other doctor, especially because as we take vacation and we're covering for each other, you'll end up getting adjusted by all of us. It's all the same adjustment. It just may have a slightly different force or rotation or feel to it, but it's the same. Especially even with the drop table in the low back. Sometimes I have people on their side and it could be a certain adjustment. Similar adjustment can happen on with the table laying down with the drop tables. Same effect, just a different force. So again, if you have any interest, if you want to try, if it's super busy and Dr. Julie doesn't have a patient, you can ask her to adjust you. We highly promote it. We love having you try everyone, because you may get a different adjustment for a certain area that works better, that doesn't work better, but it's all good. So again, we look forward to Dr. Julie growing, and let us know.